Hi, I'm Dr. Choll Kim. We're all very excited for your visit and to meet you. In an effort to welcome you and give you an idea of what to expect when you come to our visit, I just wanted to tell you a few things. First of all, we're a team. More accurately, we function like a family, including two really awesome PAs, both certified. One of them is Jennifer Handley. The other one is also named Jennifer Blevins, and they are like my doubles partner in tennis. They will help me with all the medical and surgical issues, so you'll see them a lot throughout your visit. The other thing I want to tell you about is the paperwork that you're going to receive. It's going to look like this. It's pretty thick, the first one. The first one's always the thickest one, and then after that they become much shorter. But I look at all these questions, and they're really important for me to get really consistent, objective information about my patients, and it allows me to get your symptoms from your perspective instead of me trying to jot down what you're saying and interpret it. So I like to encourage you to take time and care in filling out these forms. So some of it is self-explanatory, like boring information stuff. But here's where the important stuff comes in. Again, there's lots of pages, so do your best trying to fill them out in detail, because I do look at them. But this is the one that I think is probably the most important thing. This is what we call the pain diagram. And right here, what I'd like you to do, this is the front and this is the back. Yep. I'd like you to use these instructions and identify all your locations of pain, and feel free in the margins to write down whether or not it's constant or intermittent, and whether it occurs on a bad hair day or because you've been standing or walking too long, etc., etc. Try to be as specific as possible for each anatomic area. We'll fill in the final numbers in the bottom, but this diagram is probably the thing that I rely on the most in terms of figuring out what your diagnosis is and what to do about helping your pain and your disability and trying to get you back to life and highly functioning again. Besides that pain diagram, there's 2 or 3 questionnaires that we call patient-reported outcomes measures, PROs. These are questions that we ask the patient and we score them to give us a numerical value of your level of function. So the first one is for the lumbar spine. We didn't write that here, but that's also known as the Oswestry Disability Index. It's 10 goofy questions, believe it or not, that most spine surgeons use. So if you answer these questions, I can add them all up and give you a score from 0 to 100. If you have a score of 100, that means you're probably in heaven right now. If you have a score of 0, you have no problems and I'm wondering why you're here. And if you're somewhere between 35 and 65, that's significant. So try to fill these questionnaires out as well as possible, and probably the best advice I can give you is try to pick the least worst answer, because sometimes you'll be sitting here thinking, I don't know how to pick this, I don't know what the best answer is. In that case, since you can only pick one answer, pick the least worst. I don't know if that makes sense, but if you kind of remember that, it'll help you fill this out. So I'm excited to meet you. I thank you in advance for all the efforts that you're gonna have to put in ahead of time so that I can help you as well as possible. And we're all looking forward to your visit and getting you back to life again. So the first page, I think, is self-explanatory. It just asks you questions about things like where are your main symptoms, and just check off all the things that apply to you. Most people don't have any problems with that. Same thing with this page where you list some of the prior treatments that you had, so I have an idea of what we should do next, and a list of all your doctors so that we can copy them on our notes and keep them updated so that everyone is on the same page. Another set of questions about the medicines that you take, other medical problems. Again, I think this is all self-explanatory, but the more detailed you are, the more I know what your situation is and the better I can do in terms of formulating a customized treatment plan for you. Same thing here, boring. This is the section that I think confuses patients the most, because I can imagine people will draw this out in a variety of different ways. So what am I trying to figure out? I'm trying to figure out what location of your body your pains are in from an anatomic perspective, and how bad things are. So let me give you an example of a typical way I would fill this out. Let's pretend I'm a patient that has a herniated disc with sciatica and back pain. So I may say something like, okay, I have back pain right here. It is about 8 out of 10. That's bad, and it's constant. I also have pain going down my right leg, the back of the thigh, the side of the thigh, the side of the calf, and the side of the foot. This is like a 6 out of 10, but it's intermittent because I don't have it all the time. So I wrote intermittent, and that it gets worse with prolonged sitting. I wrote that down, or standing. So if you were to draw it out like this as the perfect patient, I would love you to death because I could just take a quick glance at this and I would immediately know, even before looking at your MRI, I would say, this person has a herniated disc. Or I know that they're in a lot of pain and we need to do something more. If you said it's 2 out of 10 and 1 out of 10, I'd know you have these symptoms, but maybe we don't want to go crazy thinking about surgery because the symptoms aren't as bad. Let's say I had neck problems with pain shooting down my arms. I may say I have pain in my neck. That's only like a 3 out of 10, a little annoying, but I have this horrible pain going down my left arm, down to my index finger and middle finger, for example. And this also has burning, pins and needles, and it feels kind of numb, but in a really annoying way, and that annoyance factor is like an 8 out of 10. So if you fill it out like this, and if it's in the front of your thigh, do more diagrams. Let us fill these numbers out based on everything, and that will take me 95% of the way there in terms of trying to figure out what your diagnosis is and what we should do next. All right, so I hope that's somewhat clear. The other set of questions that people have trouble with are these functional questions. So near the end, pages 14 and 15, you'll have these questionnaires that are 10 points each. This is for the back and this is for the neck. And this is called the Oswestry Disability Index, and this is the Neck Disability Index score. What we're trying to do here is to assess how debilitated you are from these symptoms. So you want to go down each of these questions and just pick one answer that most applies to you or that best applies to you. Turns out some of these questions are a little goofy, and so people get really confused because it's like, well, it doesn't exactly apply to me. So in this case, when you have a question that doesn't totally apply to you, your job is to pick the least worst answer. Since there's not a good answer, you just want to pick the least worst answer. You just try to pick one that gives me an idea on average what your limitations are in terms of, for example, standing, lifting, walking, sitting, reading, driving, work, concentration, whatever each question is, just pick one of these that applies to you the best or is the least worst in terms of description. And I will add these up and generate a score from 0 to 100 to give me an idea of how you're doing in terms of function. So, for example, check this out. I do a surgery on you. I have all these scores preoperatively. And then as you come back over and over again, I check these scores. And if you're doing well, your scores will get better and better and better over time. And we'll know how much. And it's really helpful to assess how you're doing, what the problem is, what should we do about it. So even though these are kind of tedious and you'd rather just tell me everything, by answering these questions, it allows me to get the answers in a really regimented, consistent, reproducible way, and it makes it so that I can take care of you a lot better. So thank you in advance for taking the time to fill these forms out because it really does help me help you better.